I'm Mahesh Ratnayaka, one of the sexual health physicians from the Royal Adelaide Hospital. I work in the Adelaide Sexual Health Centre. One of the reasons why it's more common is it's asymptomatic in most people. About 70% of women and 50% of men who have the infection would not show symptoms. So basically, you wouldn't know if you have chlamydia unless you get tested. The worst thing is you could pass it on to someone else without even knowing that you're passing it on. And in Adelaide Sexual Health Centre, we diagnosed about 1,018 patients during 2017. So STIs could be due to viruses, bacteria and protozoa. And common viral STIs are human papillomaviral infections and herpes type 1 and 2 infections. And human papillomaviral infections can cause genital warts and sometimes cervical cancers, anal cancers and throat cancers. Herpes type 1 and 2 viruses can cause genital ulcers, which are commonly a recurrent type of ulcers. Bacterial STIs are chlamydia, gonorrhea, mycoplasma genitalium and syphilis. And chlamydia, gonorrhea and mycoplasma can cause vaginal discharge and pelvic pain in females. And in men, they can cause a urethral discharge and scrotal pain sometimes. Well, the best way I think is to look at your sexual behavior during the last few months, because if you have had any unprotected sexual exposures with casual or regular partners, if they have had STIs, there's always a chance that you could have got an STI. And that's the very first clue. And the second thing is to get tested, because as I said earlier, most of these infections would not have symptoms. Therefore, unless you get tested, you wouldn't know. All the bacterial STIs, namely chlamydia, gonorrhea, mycoplasma and syphilis, can be cured 100% of the time with antibiotics. So main things with the treatment with antibiotics is you need to make sure you complete the course of treatment, and your partner is also treated because you could get reinfected, and avoid having sex until your treatment is complete, and your doctor would further advise you about it. And viral STIs like herpes and genital warts, we can't remove the virus from your system, but we could treat the symptoms. But for most HPV or human papillomaviral infections, our body's immune mechanisms would remove the virus after a while in many cases. But unfortunately, we can't cure herpes viruses.